As an infectious disease specialist, what is the most common thing that you run across?
Well, we see patients both in the hospital as well as our outpatient practice with a variety of different infections. Very commonly, we see skin and soft tissue infections. We see critically ill patients in the intensive care units with pneumonias and other complications of diabetes. As an outpatient, we see patients with a variety of infections, including viruses and HIV.
The hot topic today among most people in the community is the Zika virus. Can you talk a little bit about that?
So the Zika virus is a mosquito-borne viral infection, which has become an endemic infection in most of the countries in South America and Central America, where local transmission has been occurring. Here in the United States, we've only seen patients who have recently traveled to an area where the Zika virus is in effect and have brought the infection back with them. For the most part, it causes a mild viral infection with fevers, body aches, a rash, or pink eye. But in patients who are pregnant, a more severe illness has been described, as well as potential complications in the unborn baby.
What about the West Nile virus? Between that and the Zika virus, here in the community, which one should we be more concerned with?
West Nile virus is definitely more concerning, especially here in Texas. We have had many cases of West Nile over the years, whereas Zika virus is still in travelers returning from countries. West Nile virus is actually widespread here in the United States.
So what can we as a community do to prevent the West Nile virus?
The 3Ds are very important in prevention of any mosquito-borne illness. Number 1D is dress, and that is wearing long sleeve pants and shirts. And if you can tuck your pants into your socks, it's not very fashionable, but it's definitely something that will help with mosquito prevention. The second D is DEET, which is a mosquito repellent, which you can use safely on your body to help repel the mosquitoes from biting. And the third D is drain, which is basically drain any standing water in and around your environment to eliminate the breeding sites of mosquitoes.
If you contract the West Nile virus, what are the symptoms?
The symptoms are generally mild in a majority of patients who get West Nile, and that's fevers, headaches, body aches, and a rash. However, in patients who are older or have pre-existing medical conditions, a more severe illness can occur, particularly with neurological complications like meningitis, confusion, paralysis, which are definitely concerning.